When we discuss the cyclic nature between cancer and depression, what we are describing is a bidirectional relationship between cancer and depression. Cancer on one end and depression and anxiety on the other.
Okay, now getting to the relevance of our research. 1 in 4 cancer survivors have clinical depression, and COVID-19 has exacerbated those numbers. 77% of breast care patients in particular experience anxiety, and that anxiety increases their feeling of pain, which is a result of both the disease itself and the biomedical treatment they undergo. Now, how does depression worsen health outcomes in cancer patients? This is a relatively new topic of conversation that hasn't been researched. What we recommend is looking more so into the community. So with these cancer patients, does their community have a lot of violence and trauma that affects their stress and depression? Or does the community have a lot of food deserts and nutrition, or maybe unhealthy coping mechanisms, such as cigarette smoking, et cetera, that increases their risk of cancer? And this depression affects their ability to receive treatment, and more so how their body actually responds to that treatment.
So before we continue our discussion, it's important to define what integrative medicine actually is. It is made up of 2 components, the first component being conventional medicine. The second component is this idea of complementary medicine. That is when non-conventional practices are used alongside conventional medicine. I emphasize alongside because complementary medicine should not be confused with alternative medicine. Alternative medicine is when these non-conventional practices are used to replace conventional practices. Components of integrative medicine include acupuncture, music therapy, and mindful meditation.
And so what is our problem? Our problem is that there's not been enough research done on integrative medicine and practices, and so its uses in a clinical setting are very limited. And what this often results in is less dialogue between physicians and patients regarding these medicines and treatments. And so, for instance, you might have patients who are seeking these other forms of medicine or seeking these other forms of treatment that they don't feel comfortable sharing with their physician. And you can see in this slide, our 3 main goals are outlined. So what does our intervention actually look like? Well, it begins with 200 cancer patients from Northwestern Memorial Hospital. One half of the patients will be split into our control group, who are under the care of a physician with no intervention. And the other half will be classified as an intervention group, in which these patients are under the care of a physician who have undergone weekly training for 3 months. And so this weekly training is composed of 3 main parts, including conferences, online training, and meetings with other integrative oncologists. And we'll outline these 3 parts in the next 3 slides. So for conferences, we have conferences like SIO and ASCO, in which they build and bring together researchers and physicians across the globe to assess the current state of integrative medicine and its uses in a clinical setting. A second part of our intervention includes online training, and specifically we found that Duke's online training program was very effective, including things like mentor sessions, web-based training sessions, along with oral and written exams, so that physicians are really able to get a comprehensive idea of how to incorporate integrative medicine and practices into their daily interactions with patients. And so this is an overview or a timeline of our intervention, which will last 12 months. Now my colleague Jocelyn will go into more detail about the data that is collected.
We first want to measure anxiety and depressive symptoms amongst cancer patients, which is done using the hospital anxiety and depression scale. Data collected concerned with the cancer progression of the patients will also be collected. Finally, we are looking to quantify the patient-doctor relationship as perceived by the patients themselves. Ultimately, we hope this research will contribute to a conversation concerned with integrative medicine and its holistic approach to the cancer care continuum. Thank you to the following institutions and individuals for their support.